The number of COVID-19 cases originating from bars and clubs in Itaewon has now reached more than 200, and quarantine authorities are ramping up monitoring as the silent spread of the virus continues. They have disclosed the names of restaurants and internet cafes in Gyeonggi-do province that have been visited by infected people in their 20s and are urging them to receive testing as soon as possible.
6 people in their 20s who had visited this restaurant in Anyang, Gyeonggi-do province, have recently tested positive for COVID-19. They visited the place on multiple occasions. One of them has been found to have visited a nightclub in Itaewon on May 5th. Quarantine authorities say this restaurant has ideal conditions for the virus spread, as it consists of rooms for gatherings.
하루는 6명이 모였다가 하루는 4명이 모였다 이런 식으로다가 그룹으로다가 걔들이 계속 만나다 보니까 확진이 된 것 같아요.
The 6 visited restaurants and coin karaoke salons in Anyang between May 10th and 17th. On May 12th and 13th, they also visited a bar and an internet cafe in Gunpo. Quarantine authorities are urging everyone who visited those places on the same days as the infected people to receive testing. They are warning that those who visited enclosed, poorly ventilated spaces must receive testing urgently, as the coronavirus spreads easily through saliva droplets in confined environments. Quarantine authorities also point out that those who tested negative after visiting the club district in Itaewon during the May holiday period must receive additional testing if they develop any symptoms. Authorities are ramping up monitoring to prevent the silent spread of the virus as much as possible. As of May 20th, the number of COVID-19 cases originating from clubs in Itaewon stood at 197. Of those, 25 cases are tertiary infections and 4 quaternary.
접촉자가 101명으로 접촉자에서의 확진자가 좀 더 많은 수를 차지하고 있는 상황입니다.
Quarantine authorities stress that workers of religious, sports, medical, and other public facilities who have visited bars or clubs or come into contact with infected persons should receive testing to stop the spread of COVID-19.